It's 8:39 News Radio 1029 KARN. First News. Kevin Miller with Dr. Tina Ipe. She's the Associate Professor and Medical Director for the UAMS Blood Bank and Transfusion Division. Big responsibility. Dr. Ipe, good morning. How you doing?
I'm well. How are you, Kevin?
I'm hanging in there. I'm doing my thing. All right, so there's word about this whole coronavirus treatment involving transfusion, antibodies from people who have had or been affected by coronavirus. What do we know about this?
Certainly. So, from the early beginning of this year, we have been providing convalescent plasma to patients, and these units, or these convalescent plasma units, have contained the antibodies to help people that are trying to fight the disease in the hospital actually fight the disease.
Right. Is this a new therapy? The president talked about this the other day. Is this something that's brand new, or is it something that's been going on?
So it is not a brand new therapy. It has been used in other pandemics as well as in other situations, such as MERS and things like that. So it has been a therapy that has been used. What we don't know currently is, the use of convalescent plasma for COVID-19. So that is what we, are currently looking at all the clinical trials, participating in our own to determine the benefit of convalescent plasma for those patients that are suffering from COVID-19.
What are the risks for somebody that does this?
Certainly. So the risks are similar to anyone who is actually receiving a blood product. So there are, all of the transfusion reactions that one needs to be mindful of, such as allergic reactions, anaphylactic reactions. You have volume overload reactions. So there are a lot of things. There's also, we have to be careful that we give the right blood product or the right type to the right patient, because if you don't, you can have an acute hemolytic transfusion reaction as well.
I don't know what that is, but it sounds awful.
Yes, it basically causes all of your red cells to break up in your body.
Yeah, I don't want that.
Nope.
That sounds like something you've been tased by somebody in some space movie or something. Dr. Tina Ipe with UAMS. What about this? I mean, the president has pushed this idea of doing this. Is the FDA approving this? What do we know about the science behind it as far as why it's important right now with COVID-19?
Sure. So, I'm not a politician, but I can certainly speak to the science of it. The science is that, we know that from studies such as the Mayo Expanded Access Program that there has been some strong signals that show benefit to patients. But again, randomized controlled trials where there is a comparison arm need to be conducted. Saying that, I do want to emphasize that more data will help determine the benefit to patients. So we certainly need all expanded access programs to currently be underway, all of the randomized controlled trials or even clinical trials to be underway, despite the issuance of by the FDA.
Dr. Tina Ipe, she's with UAMS. What about this in Arkansas? Is it being used here, and are people that may have had COVID-19 being asked to donate plasma for this?
That is absolutely correct. So, we have had a very robust response with the Arkansas initiative to have individuals that previously had COVID-19, not only in the hospital but also in the community, to go and donate. The only caveat to that is that they needed, the nasopharyngeal, or what we call the PCR-based test, to be able to go ahead and donate. We continue to encourage those that have that testing result and, are symptom-free for at least 14 days to contact their local blood collectors. And our local blood collectors in the region are the Arkansas Blood Institute, the Community Blood Center of the Ozarks, LifeShare, and the American Red Cross.
Kevin Miller talking to Dr. Tina Ipe with UAMS. When is this used, this therapy? I would guess that if somebody just happened to have a milder case of COVID, probably not. But if somebody, is this like used in the intensive care? When do we see this happen?
The FDA criteria previously was that it was given to hospitalized patients that were at severe or life-threatening risk of COVID-19 syndrome. It has become a little bit more ambiguous with the issuance of the EUA, but it is my hope that hospitals around Arkansas or physicians treating patients in Arkansas would continue to follow the previous issuance by the FDA regarding which patients should actually be given convalescent plasma.
Right. What about other sciences that are out there? I mean, I know there's talk of trying to get a vaccine, no doubt about that. But, I mean, what other therapies? Do you know of anything that's available other than this plasma treatment?
At the present moment, all therapies, right, are under review. So for example, despite the issuance of the EUA, it continues to be an investigational drug, the convalescent plasma. So we just want to ensure that every therapy that is available undergoes studies that determine the clinical benefit prior to it, being used widely in patients.
Dr. Tina Ipe with UAMS, the Blood Bank and Transfusion Division. I certainly appreciate you being on this morning. Thank you for the information.
Certainly.